whenever you try to change a behavior, it's similar to, if you've got a remote control for a TV and it doesn't work, what's the first thing you do? You press that button again, press it harder, press it loads of times. And that's just human nature. And it's the same with, okay, last time I did this, my parents came through, but they stopped doing it. Well, I need to do it more. I need to do it louder, and I need to do it for longer. So you would expect initially there would be more of the behaviors that made you come through, whatever they are, they're going to increase. They're going to get more intense. What we would encounter in clinic is people had started sleep training interventions, and then it had just got too much for whatever reason, and they'd kind of given in at a certain point. Unfortunately, what that does is teach the child, oh, so I need to cry for 2 hours. And then it kind of perpetuates the problem even further. So that's why it's kind of working out a plan. What's most realistic for you? What if there's 2 parents or caregivers, what can you both do? And is it agreed? And then sticking to it as much as possible. So we know consistency is really important. And it can be even more important when children are on the autistic spectrum, because it kind of gives that sense of, I'm safe. I know what's going to happen, even if it's not exactly what I want to happen. I know that that's going to be the outcome of this thing. That makes the world more predictable. That's lowering my anxiety. That's probably going to feed into me being more able to sleep.
When people are trying this and it doesn't seem to be working, at what point do they say, actually, we need to try something else and stop with this particular approach?
I think you will notice reasonably quickly if things are helping. It's worth sticking it out for a few days if you can. But we appreciate it's difficult. It's hard to do these things. Another thing that can help with the nighttime wakings as well, that I haven't mentioned actually, is bedtime passes. So you give your child 1, 2, or 3 passes at the beginning of the night, and these preferably with a character that they like or something to do with their special interest, and then say this can be exchanged for a kiss from mum or a hug or a glass of water, whatever it is that they might want to do in the night. But if you hang on to it until morning, you can get a reward. I think it's important to try and, whatever you do, stick with it as much as possible, because it's a shock to you, it's a shock to the child, and so it's going to take a while to adjust to it. And also trying to communicate to them as much as possible, this is what we're doing and this is why we're doing it. So younger children, that might be harder, and depending on kind of developmental stages and levels, it might be that you might have to communicate that in a different way than with language.
I often find that with things around rules or asking someone to do something, that often with autism, that actually explaining the rationale behind it, again, at whatever level someone's able to access it and why it's important, can be really helpful in that process. If people are just being asked to do something and they don't really understand why. Again, it's more difficult with younger children, but I can imagine that being really helpful.